5 important questions regarding your baby you need to research and be prepared to answer before you go to the hospital. Number 1, if you're having a boy, do you want your baby to have a circumcision? There's so much that could be said about that, and it's important for every family to make the decision that feels right for them, so do a lot of research and feel good in that decision. Number 2, you need to know if you want your baby to receive the medications that are recommended and typically given to newborns at birth. Those medications are erythromycin antibiotic ointment that would be placed into the baby's eyes to prevent blindness related to an infection that the mother might have, typically gonorrhea, chlamydia, or even E. coli. The second is a hepatitis B vaccine, which helps prevent a serious disease of the liver called hepatitis, which can cause cancer and many other complications. And the third is a vitamin K shot. Vitamin K would help the baby clot his blood while his body begins producing it more naturally. Without good clotting abilities, the babies are at higher risk for developing bleeding, particularly brain bleeding. Another thing to keep in mind is many hospitals will not do circumcisions if the baby has not had vitamin K because there's a risk of bleeding. Number 3, what's your family history? The pediatric team is going to want to know specifically if anybody in your family had jaundice, if anybody required phototherapy, which is those little lights that I'm sure you've seen, or the Billy blanket lights, the anatomical abnormalities, genetic abnormalities, diseases, anything genetic that maybe we need to be looking out for in the baby. Number 4, what are you going to name your baby? This may sound silly, but a lot of people are still not sure about their baby's name or their middle name, and that's okay. It's a hard thing to choose. But if you do want to have the hospital help you fill out the birth certificate and send that form in for you, you are going to need to have your name ready to go. And number 5, who do you want your child's pediatrician to be? This is a really important question because the relationship you build with your pediatrician is one that lasts for a long period of time, ideally throughout their entire childhood. In addition, the hospital or wherever you give birth is going to typically draw lab work that tests for certain anomalies and genetic abnormalities. They send those results to the pediatrician. So it's super, super helpful for you to know where to send those results. Also, when you're discharged, your care team is going to be scheduling an appointment for your baby within the following day or two so that they can check the baby's weight, make sure feeding is going okay. It's really important that you know where you want that appointment to be set up. I could do a video on any one of these points in and of themselves. Let me know if that's something you're interested in. And for more information about pregnancy, labor, birth, give me a follow and check out my page.